most famous physical therapist on the internet.
Howdy, folks. I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
We're the most famous physical therapists on the internet.
In our opinion, of course,
Humble
Bob.
opinion. Today we're going to talk about everything you need to know about skin care when using a prosthesis. And you know what? We're not going to tell them. We're going to have people come in and tell us how to do this because we're not experts in this area.
We have literally experts here with years of experience, and on both sides, patient as well as caregivers. So let's get on with it, Bob.
Right, professionals.
Thank you.
By the way, it is National Limb Awareness Month. Limb Loss Awareness Month. I'll get this by the third or fourth video. But by the way, if you're new to our channel, please take a second to subscribe to us. We provide videos how to stay healthy, fit, pain-free, and we upload every day.
That's right.
Also, go to bobandbrad.com. Go to the giveaway section. We're giving something away. We don't know what it is.
Right.
This is a future video.
But just go and it'll be there listed.
Yeah. Go to Facebook. The contest will be pinned to the top of the page. Go to Twitter, Instagram, TikTok if you want a 60-second version of our program. And
we've got podcasts going now with
podcast.
Outstanding interviews, and they're all educational,
real experts.
and entertaining, aren't they?
Yep. We'll bring our guests in now. Okay, I'm joined here by Brandon from Lim Lab, and I'm going to have him talk about Lim Lab a little bit, and Randy from Michigan. Who is Randy the Magnificent, I like to call him. And he's going to...
Can you tell my wife?
Yeah. Hi, wife. He's magnificent. So I want to talk about Lim Lab a little bit first.
Sure. Lim Lab is a prosthetic and orthotic company. I'm a co-founder along with two other gentlemen. We have locations... in Rochester, Minnesota, Minneapolis, Minnesota, Mankato, Minnesota, La Crosse, Wisconsin, Lincoln, Nebraska, and Scottsdale, Arizona.
Fine organization. We've dealt with them many times in having patients of theirs, and really professional, knowledgeable. I love working with you guys.
Well, thank you very much. Yeah, we had a great team. We have a staff of about 43 now, and I can't believe it. Started with 3 of us 7 years ago.
Sure,
and
cool.
Man, how time flies,
Yeah.
But one of the things I think that has been a big part of just our ability to keep growing and our success is our ability to connect with people that want to become more active, that are on the move, that want to learn how to push the envelope and be as functional as they could possibly be as an amputee. And a lot of that is attributable to our relationship with therapists like yourself and physicians that take care of patients who become our clients, and an educational aspect of it. How to take care of things, skin issues, for example.
Big
Very,
issue.
very simple thing, but it can become a big problem if you don't pay attention, right, Randy?
Big problem. You get water blisters, you get hot spots, you get ingrown hairs. Ingrown hairs are pretty bad.
Yeah.
Because every step, right?
Right.
Every step,
You're reminded.
you're getting hammered.
It's like
We've done other videos on how you take this on and off, so we'll just take it off quick.
Sure.
And let's show people your limb. Randy's an above-knee amputee, amputated right at distal femur. And luckily for you guys today, you can see there's a little purple here.
There is a little purple there.
But this isn't probably totally from the prosthesis. Randy has another little story that happened the other night.
Well, as I was getting the camper ready to come, right, it was going to rain. I had left the slide out. And I go, it's a thunderstorm. It's 5 o'clock in the morning. I better put that slide out. So I grab my crutches and I run out to the crutch out. To the camper, right? Steps, all that. I get up on the camper, put the remote, put the slide in, right? I go to get off the camper, the bumper of the camper, and I just put my right leg back behind me like it was still there.
Oh, sure.
And down I went.
Years.
Yeah.
So I hit I hit the cement with my end of my limb.
Oh,
so that's scraped up a little
that's
bit.
what we're seeing here.
However, it looks very similar to somebody that would put their silicone liner on wrong.
Oh, really?
Yeah.
Like if they don't have
like a hickey.
Complete contact?
Yeah. If there's an air gap down here,
makes sense.
It's like a suction cup look. So we're kind of lucky today that we have this little purple discoloration. So if your limb, if you didn't fall off of your camper and your limb has some purple look to the bottom of it, it's because your silicone liner probably is either not making total contact with your skin and making a suction cup look down here, or you don't have good contact inside your prosthesis. So you have to pay attention to those things. So Randy, when you look at this, you're going to manage this, right? You're going to kind of be careful with this. You're going to clean it. What do you do? What's your program for cleaning your skin on a daily basis?
I just take a normal shower, usually in the evening. Your limb tends to recover over the time that you sleep at night.
Sure.
And I don't know if it gets better at doing that, but it seems like it does to me. And you'll get hot spots during the day. You'll get little wear spots.
You say hot
There's,
spots pain or hot spots skin discoloration? I mean,
The hot spots are because of rubbing.
but is it pain?
It's not so much pain to begin with. It starts just like a hiking boot would start, and you'd say, "Oh, wait a minute, I got to stop and put something on that hot spot."
Not quite right. Yeah.
And so sometimes I'll stop and I'll use a little blue towel that they use. Mechanics use those little cloth blue towels. I'll put that over a hot spot, roll my limb back or roll my liner back on, put my leg back on, and I'll be good to go. But those hot spots, if you don't pay attention to them, they end up turning into water blisters.
Sure.
And under no circumstances, no matter how bad it itches, do not itch it. As soon as you itch that hot spot, it becomes a water blister.
Good piece of advice.
So,
And what when you roll your liner off, you take your leg off at the end of the day, and you notice some redness. What level of redness concerns you, and what doesn't concern you? Is there an amount of time that it takes to go away, and you're like, okay, that's going to be fine?
yeah, when it's angry red, right? I mean,
can you show some redness right here? There's some redness right here, and there's supposed to be. You want
there's
to
a little bit. Yeah.
mention contact areas here, Brandon? Where
Yeah,
are
so
these?
we're really trying, especially with a socket like Randy wears, is we're trying to control the femur by putting pressure in these 4 quadrants. And one of the ways to
So 1,
protect the
2, 3, 4.
Yep. To
Okay.
protect the cut end of the bone is to load right above the bone. And so we counteract that driving force by loading above it and letting this kind of be.
Sure.
So if you feel right here, you can feel the cut end of his bone.
Oh yeah.
And this is a good place to counteract that drive towards the socket as he walks. So you'll see increased pressure on this area here because it's intentional. And we just have to balance that with the proper amount, right?
By the way, Bob, you have to become completely non-shy.
Sure.
If
Yeah.
you're shy at all,
Yeah.
You and your prosthetist aren't going to get along.
Modesty went out the window, right?
Yep, modesty's
And
gone.
So you also mentioned in the last video that there's weight bearing on the sit bone.
There is.
And now, what about redness there? Worry about skin breakdown there, or not? Does that not
We
happen?
do. We pay very close attention. So as the biggest thing I can kind of tell someone who's watching this who wears a prosthesis is no detail is too small to
Sure.
mention to your prosthetist or your therapist or your
Good
doctor.
point.
Don't put up with something. It's not going to get better
Yes.
by ignoring it, right?
Right.
Don't be afraid to make a phone call or drive 9 hours to your prosthetist and show up at their doorstep and say, "Hey, I got a hot spot here." And I spend a lot of time looking at the exit of the tissue around the brim. When skin sits here and kind of gets pulled on that edge, it can get stretched and red and damaged or blistered. And so Randy kind of came up with he had ingrown hairs that would happen around this brim. And that's mostly, when you're really wearing this for 12, 15, 16 hours a day, you start to get some friction areas. He came up with a little clever trick that is the spandex material. He cut that off and wears it inside the liner.
Oh, so this wasn't a full pants then?
It was a little longer. They had a little
This
seam
was.
on it.
Oh, I see.
had a
I
seam.
gotcha. I gotcha.
If we left this seam on there,
That would
cause
give
major problems.
Sure. Sure.
Just pressure points underneath the
Gotcha.
liner. So I cut that off, and this just keeps it slippery.
Sure.
So
Now,
Makes sense.
Randy gets away with a few things because he's an experienced amputee. If this was your first one, you're like, well, how does the liner stick on his limb like that?
Right.
It's not the best example. In if I was to have my opinion, slide your shorts up to here, Randy.
That's where you'd want them.
I would try to have at least 3/4 of his limb
Sure.
contacting the silicone, and that's going to get you the best suspension. Randy pays attention to things. He knows when he's in trouble. He knows
I
Sure.
don't always listen to you,
he
Brady.
doesn't
Yeah.
always listen to me, but that's why we make a great, because I always don't listen to him either. So we make a perfect team. But that's kind of the general rule. You want to have as much skin contacting your silicone liner as you can so that it has good suction contact, and then protect your skin accordingly. So the type of soap you use, you've probably, when you first started, you probably listened to me and used soap that was
No, never.
non-fragrance, no perfumes
Sure.
in it, something
Makes
very
sense.
simple. Things that you've used on your hands that you're not allergic to, and really rinse your skin. You want to have a clean, dry environment when you put your silicone liner on. You don't want bacteria in this thing. We don't
Makes
want
sense.
we don't want soap residue on your skin, because that causes slipperiness and irritation. And those are the things that I tell everybody. That's the book answer. In reality,
Well, the inside of this liner is actually got, when you originally get them, they have lanolin on them. And so that they do that to keep them nice and soft and
Sure.
ready for your skin. And then after a number of days, that wears out.
Gotcha.
And
And you don't replace it.
no,
Oh.
just
Do-
keep your skin clean and dry, and don't use it too much.
Do you want to talk, Brandon, a little bit about the initial,
Yeah.
when you first have the amputation and you're preparing the residual limb for prosthesis? Because that's
Yeah.
quite a process.
it is quite a process, and the caveat here is that everybody heals at different rates and things like that. So we do have a general timeline set up on limlab.com, that you limblab.com, that you can go to, that takes people through kind of your journey, start to finish. But in a nutshell, it is about a 6 to 8 week process from the time of amputation to the time that you're fit with a prosthesis.
Mhm.
An actual one that you can weight bear in. And in the initial stages of following amputation, our main goal is to protect and shape the limb. So we use a variety of things. You can see from plaster casts to ace wraps to fiberglass shells, but the general concept is apply a light to increasing amounts of compression as your skin heals. Once the stitches are out at about 3 to 4 weeks in there, you can start being more aggressive with the type of compression that you put on. And the whole thing is getting you ready for game day. Slowly protecting. Use your crutches. Don't fall off your camper. Don't go backwards. Always go forward, and try to get this limb shaped down and get the swelling, the edema, as we call it, out of the way, so that when it's time for you to wear your prosthesis, you've kind of come down in size, you're protected, the suture line is well healed and protected, and you will definitely increase your functional ability faster with less frustration if you pay attention to that.
Why don't we talk about the diabetic leg, someone who has diabetes, because that
Yeah.
obviously throws some extra cautions
So
there.
it still is dependent on how people heal. At that point, when people have an amputation, the leading cause still is in the United States of limb loss is diabetic.
Diabetics. Yeah.
Being diabetic. Did you know 1 out of every 200 people in the United States wears a prosthesis?
No,
Yeah.
that's shocking to me.
500 people every day have an amputation
Wow.
in the U.S.
So there's more of me.
Yeah.
There's a lot more.
There's
not
only one
I
of
thought
you.
I was the only.
There's
show
only
in
one of
town.
you.
No. There's
Come on.
there's not many quite like you, Randy. But that's one of the things that I spend a lot of time doing, especially in the month of April, is Limb Loss Awareness Month. Is educating people. How many of folks like Randy are there in the community?
Sure.
But as a diabetic amputee, it's even more important to keep an eye on how things are looking on when wearing your prosthesis, and going back to the healing process right after surgery. We want to give no excuses for this not to heal. Gently wrapping your limb, following your physician and your prosthetist and your therapist's instructions on how to properly wrap your limb. keeping it clean. For those first 3 to 4 weeks while the stitches are in, not doing any soaking or following all these instructions. And you should get those types of specific instructions from your physician or your therapist after you've had an amputation. The name of the game with all of this is to get ready for game day, is to protect your limb, keep it wrapped, get the swelling to come down. That encourages healing. It speeds up the process. And when you're ready for your prosthesis, anywhere 6 to 8 weeks after your initial amputation, if all things go well and there's no infection and there's no delay in healing, you'll be up and standing and starting to wear your prosthesis with your therapist for an hour a day and then an hour and a half, and you'll go through this general break-in period, and the next thing you know, you'll be as functional as you can be and doing and living your life,
That's
What's-
only if the patient listens.
Yeah.
I have
True.
trouble with that.
I know.
Ask my wife.
Yep.
What's a typical length of time? I know you can't probably give a a standard answer, but for how long they keep the prosthesis on? I don't know, Randy.
Most people that I'm aware of will put it on to go to work, and when they get home, sometimes they'll take it off for
Sure.
the evening, or sometimes they'll do whatever and then take it off later at night, maybe 8, 9, 10 o'clock at night. Quite often I would work all day and then have to work all night. I work for an internet company, and people like their internet during the day,
Sure.
so I had to do my work at midnight. Fun. But the longest I've ever worn my prosthetic leg, I think, was 27 hours, which was too long.
And did you have skin problems?
I
You were starting that way.
yes, it was headed that way, and I knew I had to take it off.
Sure.
And so we took it off and rested it for 8 hours.
Sure. And
when someone comes into my office and they say they're frustrated, they're not wearing their prosthesis enough, or the big question I ask them was, well, what do you want to do? And I have this blank sheet of paper and I write down their goals, and a lot of their goals are, I just want to be able to wear my prosthesis from the time I wake up in the morning to the time I get home from work and I go to bed. So, a good 12, 14, 16 hours. That should be doable. And then I asked, well, why can't you? Well, this, and this. So then that just kind of helps us shape our roadmap to success, right? So we address those specific things. It's usually quite simple to fix, but they cause this it causes this big problem and frustration of not being able to wear it. So
Right.
it's usually just a little pain here that turns into a big deal after 3
Exactly.
hours. We address that, it fixes that, helps them increase their time, and that is a win. And then we help people wear it as long as they want to be able to wear it.
If you wear it too long, it typically takes me, I'm not diabetic, but it takes me about 3 days to recover
Sure.
from not paying attention.
Sure.
And again, if you don't have your prosthetic limb, it changes everything, because then I'd be on crutches or wheelchair.
Yeah, for 3
and
days.
you're certainly not going to be doing a lot
Right.
on those. So,
Yeah. Life will teach you lessons, and it'll keep teaching you, won't it?
oh yeah.
It doesn't stop. So, all right, why don't we stop there? We got a couple more videos to do, and my earpiece keeps falling off, so I'm going to get that readjusted. Thanks for watching.
Thanks.